Hello, everybody. Welcome to the very first episode of the Vita Veda video cast. My name is Priyank Sharma. You can call me Dr. P, and Vita Veda is my longevity medicine practice that I started about a year ago with the mission of bringing longevity medicine to 1 billion people worldwide. And this video cast and any other content we make are critical to meeting this mission because I can only see so many patients in my lifetime, but I'm passionate about bringing longevity medicine to everybody. And today we're going to talk about why I'm so passionate about that. But first, why the name Vita Veda? I wanted to introduce this because I think the concept is really important. We have fantastic, amazing, cutting edge science that has created Western medicine, modern marvels like transplanting hearts and reversing hepatitis C, which was a recent one. I'm sure we'll talk about that at some point. But also, we have these amazing traditions from Eastern medicine, from Chinese traditions, Indian traditions, and really all over the world. Hence the name Vita, which is Latin for life, the ancient Western language, if you will, and Veda, which is Sanskrit, the ancient Indian language for knowledge. Some of you have heard of Ayurveda. And we're fusing the best of both worlds here to help keep us healthy and move forward into the next centuries and really help us keep advancing as a race, as a human race. So if you'd like to support us, please follow us on Twitter, YouTube, and sign up for our Substack newsletter. The handle on all three is at Vita Veda Health, and I'll include all this in the show notes as well as any other items and references that we discuss. What are we going to talk about today? Today, we're starting with an overview of longevity medicine. What is it, why you should care, and how you can get started. And I'm going to use a talk that I've given in person a couple times, tweaked it a little bit just for this video cast. It really resonated with folks and has helped motivate me to put this information out there. And in the future, I'll be taking you through specifics on what I discuss with my patients. I really want to give you the tools and the knowledge to go and apply this to your own health. That's my mission here. So stay tuned for these future episodes. And a quick overview of this episode, which really is a Longevity 101 intro. I'm going to start with a little bit of my background, who I am, and then I'll explain the core problem that longevity medicine addresses. Following that, we'll go through a framework on what is longevity medicine, how do you even think about it, which will encompass the low-hanging fruit, like making sure you don't have a heart attack or a stroke before, say, you're 70 years old, all the way to some of the more science fiction, cool ideas like regenerating your organs or living forever, the longevity escape velocity that people talk about. And then finally, we'll round out the conversation with how you can get started on your longevity journey. And as a bonus, I'll show you some skills that you can implement right away for free to help you stay healthy. So let's jump into all of this. And I'm old school. I like PowerPoint slides. So we're going to go through a PowerPoint slide. I'm sure this will be evolving as time goes on. But for now, let's go ahead and do the PowerPoint slide. And before you all comment about how I need to do that better, I know. And I'm very, very open to suggestions for this. So let's hit it. What is longevity medicine? Why should you care? And how to get started. Let's talk about me a little bit first. So I was on the path to becoming a prominent dermatologist, have a fantastic career. I was trained at all the top institutions, did my medical school at the University of Pennsylvania, research fellowship at Brigham and Women's Hospital in Harvard, then did my internal medicine year at a really tough but fantastic learning institution, University Hospitals, Cleveland Medical Center up there with Case Western. I was accepted into dermatology. Everything was going on track. Unexpectedly, my mother got stage 4 breast cancer, and we'll talk about two of the issues that arose that this really shed light on. One, why did she get cancer in the first place? She was doing everything right. She was eating well, never smoked, never drank, exercised, was in good shape, not obese, none of the risk factors, no family history. So what happened? Then, why wasn't it detected? As we'll talk about as time goes on, cancers, you really want to catch these early on. The earlier you detect them, the better off your chances are. So a lot of the cancer industry is about catching these things early. So what happened? Turns out there were a few issues with the system as I dug further into it. And I realized we are doing things wrong. Now, you've probably heard this from many other places. You probably potentially heard of Dr. Peter Attia. Maybe you heard of Brian Johnson, RFK Jr. now, who's very prominent as the political winds have shifted in the US. All of this is coming up to light. I went through this journey about 4 years ago. Then I wanted to learn how to do this. I spent 2 years learning the nuances of longevity medicine. Over the last year, started seeing patients in my telemedicine practice, and now I'm sharing all this with you. As I mentioned, my mission is to spread this new paradigm of healthcare worldwide and reach 1 billion people. All right. So I want to start with some broad frameworks to help you understand how to think about your health. This is how I think of it, and this is what has made the most sense to me. There are three main pillars of your health that the healthcare system and you want to be addressing. One, manage unexpected acute conditions. You get appendicitis, you sprain your ankle, you get strep throat, okay? Two, prevent debilitating chronic diseases. You're not going to be able to live until your 70s, your 80s, or 90s if you're having heart attacks and strokes. And even if you do live that long, you're not going to have a great quality of life. This isn't just about living. This is about living well. Third, maintain a certain functionality physically and mentally. Do you want to be able to carry groceries when you're old? Do you want to be able to fly in an airplane, get that overhead bag up into the space, up into the overhead compartments? Do you want to be able to do your taxes? Do you want to be able to play games with your grandchildren? All those things require a certain level of functionality. The current healthcare system in Western healthcare systems is failing us because it was only designed for that first use case for acute care. It's very much so a square peg trying to fit into a round hole. And that's why we're not seeing results. Life expectancy is dropping, driven primarily by chronic diseases. In the US, life expectancy is 76 and roughly 76 and a half years. That's the lowest it's been in 2 decades. 60% of these deaths are due to chronic illnesses. And to be honest, I think the number is probably a little bit higher. They get fuzzy when you code exactly what somebody died from. It's not actually a straightforward answer. Secondly, chronic diseases are starting earlier in life. 54%, more than half of US adults 18 to 34, so not even 35, 40 years old, have one or more chronic disease. This is as of 2019. I would suspect this is only rising. And the medical education system has not changed in decades. And doctors who are done with training are too busy to adapt. So it's not going to come from inside of the system. We can't just assume that things are going to change. There's so much money, especially in the US, in the healthcare system that really stands to benefit from the status quo that'll be very difficult for this to change internally. And by the way, this is the case in a lot of other countries. I am of Indian origin. And if you go and look at India, chronic diseases are exploding. Any westernized nation, this is starting to happen, and most nations are starting to become westernized. Countries that are not westernized are still kind of dealing with that first issue, the unexpected acute conditions. We're handling number one very well, the system set up for that. Number two, debilitating chronic diseases, not very well. And we're not even touching on number three, maintaining physical and mental health. But that is what every individual will want as they age. So what is longevity medicine? It focuses on those second two pillars, chronic disease prevention and functional health. How does this work? We start with your goals. Do you want to live into your 80s, 90s, 100s, 110s? There's no right answer. It's whatever you want. You can change your mind 2 years from now. You can decide it wants to be different. That's fine. But you want to at least set a target. What decade do you want to live until? And what functionality do you want to have in that age? Then we apply evidence using science to learn where you need to be now in order to reach those goals, in order to get to that point where you can actually live to that age and have the functionality you want. This is really important because you don't want to be sitting in a nursing home for the last 20 years of your life or sitting in a wheelchair. You want to be able to do the things you want to do and live your life. Then so now we have our targets. We see where you are at right now, and then we continue to test and course correct as rapidly as possible. That is the main principle. So it's fundamentally personalized because it has to do with what you want to do. It is proactive because we're checking often, and it is comprehensive because, as an old basketball coach used to tell me, a chain is only as strong as its weakest link. So we'll get to that. We'll get a look at what does a comprehensive longevity medicine look like. But the goal of longevity is to improve your good years, not simply keep you alive. I want to really hammer on this point. So there's a couple terms here. Health span is the number of disease-free years you have, and lifespan is the total number of years you live. And in order to expand lifespan, in order to live longer, you need to extend the number of years that you are disease-free. And when they've done studies on the centenarians, these people who end up living 100 or longer, it's not that they live longer with heart disease or diabetes or cancer. It's that the heart disease, diabetes, or cancer does not occur for them until later in life. So a lot of people are kind of concerned that, well, I don't want to just live longer for no reason. I want to enjoy my life. You will be enjoying your life. That is actually how you live longer. So that is always our goal. We always care about extending your high quality years more than we care about keeping you alive. Now, let's look at a practical example. This is talking about functionality and being able to do different activities when you are at an older age. And here on this graph, on the y-axis here, we have VO2 max, the vertical axis. And what VO2 max is a really good representation of your aerobic fitness. And on the x-axis here, we have age. And I first want you to pay attention to these horizontal lines. These horizontal lines represent the amount of VO2 max, the amount of aerobic capacity that you need to do certain activities. So to run 10 miles an hour, you need roughly 56 VO2 max. And the units here are milliliters per kilograms per minute. So they are normalized, they are adjusted for your size. Briskly climbing stairs is a certain level. Running 6 miles an hour is about a 35 there. And so as you can see here, that means that you want to maintain that level of aerobic capacity in order to do certain things like that you may want to do in your 80s or 90s, right? And obviously you need to be alive and you want to avoid having a heart attack and having a stroke because that's going to make these things a lot harder. You want to avoid injuries as well. So there's a lot that goes into it, but you can see that even starting now, we can train and try to keep you at that level. And what these curves here, the ones that are here in green, blue, and red are showing you are that people who tend to be higher in earlier age in this metric, VO2 max, tend to stay a little bit higher, but there's a big drop off. Now, I'm hopeful that these drop offs won't be as extreme as more awareness and more of this paradigm of longevity medicine spreads. And another takeaway from this graphic is that you want to get started on this earlier rather than later. I mentioned a chain is only as strong as its weakest link. All right, so proper longevity medicine requires you systematically addressing all areas of your health that can cause disability or death. And I've loosely categorized these into biologic, physical, mental, and other. I won't read through this slide. I know it seems like a lot, but I would just want you to know that you're used to managing this type of complexity for your house, for your cars, for other elements of your life. And by the way, this is the job of a longevity medicine doctor. It is my job and any other longevity medicine doctor to make sure that these low-hanging fruit are not missed. That's what we cover. That's what we're here for. And if that seems like way too much, I have great news for you. Simply focusing on the basics will lead to much, much better health over the long term. So in my practice, for folks who just want the 80-20 low-hanging fruit, focus really on 7 main areas here. So in the biologic category, cancer prevention, cardiovascular disease, glucose metabolism or diabetes, dementia. On the physical side, aerobic and strength. And on the mental, sleep and stress optimization. Which, by the way, in this practical skills part at the end that I mentioned, we'll cover those. But the analogy that always comes to my mind is right now in modern medicine, and I'll probably do a whole episode on why this is the case. But right now in modern medicine, we're flying a plane, but we're going through a mountain range. And it's like we're just looking up occasionally. This is your annual checkup. Oh, something happened. Did one of my wings get clipped? Is one of my engines out? That's the problem, is we're not looking up frequently enough. It is not proactive enough. And yes, there's all of these interesting ideas for, how can we live forever? How can we regenerate our organs? How can we use stem cells? All of that is fantastic, and I love all that. But it should fit into a framework of preventing all of these diseases and optimizing these different areas. And I will tell you, 99.9% of people, there's low-hanging fruit where we're trying to get you to live to 100 years old. Let alone talk about never dying. Let's handle those low-hanging fruit. Let's take care of those. It's not actually as hard as you think. It's not as expensive as you think. And I'll talk about that in a second. So how do you get started? Step 1, learn what to assess and determine your current targets. I'm going to be releasing educational content with Vita Veda, as I mentioned. I also recommend Dr. Peter Attia's content as well. It's fantastic. Step 2, perform your assessments. Now you've figured out, all right, what are the different areas I need to look at? What are those biomarkers? What are those assessments I need to make? Then go and perform them. There are many direct-to-consumer blood work companies in the US and in Europe. I'm sure this will be emerging in other countries as well as getting diagnostic imaging. And there's a lot of these assessments you can just do in person. Or you can try to find a doctor who can help you with that. Step 3, intervene where you're off course. All right, now you know what to look for. You've gotten a baseline of where you're at, and then in areas where you are off target to meet your goals, start intervening. My content will help you create a plan, but this is where if you need a prescription, or if you have a pre-existing condition, or if you need other help, you might have to go to step 4, which is find a longevity doctor. My practice is currently open for new patients. It won't be forever, but I will tell you step 4 is the hardest. And I'm going to touch on that in a minute, but that's part of my mission. That's part of where we'll be helping. Takeaway, regardless of where you are in the journey, reach out to me and I will help you. Even if you can't be my patient, even if you don't want to be my patient, it doesn't matter. I want to help everybody get there. So question, why aren't there more longevity medicine doctors? Well, it's actually really hard. It took me like 2 years to get up to speed here. This is first principles medicine. You have to question the guidelines. You have to create new protocols from scratch. Doctors aren't really trained to do this. There's no formal medicine programs for longevity medicine. There's no residencies as we have in the US. Another issue, insurance won't pay for this. It's a whole nother podcast. And doctors are not skilled in helping patients with behavioral change. As you'll see as time goes on, a lot of this is really about changing your behaviors and getting a lot of diagnostic tests. And that's just not something that we learn. I picked it up myself, other folks have too, but it's not part of the formal training program. So it's difficult, and only the most motivated doctors are willing and able to practice it. But here are some good signs of a longevity doctor, good longevity medicine doctor. They will not skip the basics like diabetes and dementia. They won't go straight to peptides and other injections. Again, those are great, those are helpful, but they are not the low-hanging fruit. Do not miss the low-hanging fruit. A good longevity medicine doctor will lean on scientific evidence whenever possible, and they'll explain their principles when the evidence is missing. We don't have evidence for a lot of things, but you should at least check. You should at least have a point of view on that. They'll explain the science to you in a way that you understand. They'll meet you where you're at. They're not going to push you to do everything and spend a bunch of money. If you don't want to do a full body MRI yet, don't do a full body MRI yet. The job of the longevity doctor is to explain it to you, what the pros and cons are, and then it is your job to decide. If they feel strongly about something, they'll tell you, but it is still your job as a patient to decide. It's our job to inform you. First, second, often third line treatments should be habit change rather than going straight to a pill or a supplement. I tell this to all my patients. Pills, pharmacology, supplements, they all have side effects. Habit changes don't. There are some situations where the first line will be a medication. That is okay. The point is, sometimes it should be, hey, let's work on your diet. Hey, let's exercise. That's how it should be. And finally, if they're trying to sell you on things, especially things that come from their own clinic, these are some of the things that you should look out for a good longevity doctor. I want to leave you some practical tips before we go into the skills demo for your longevity journey. You do not need to go 0 to 60. You can do that if you like. You don't need to go straight to be Brian Johnson spending $2 million a year on your longevity journey. That's fantastic if you want to do that, but that's intimidating for a lot of people. Just be aware of it and start. If you get 20% better in the next year, I'll be very happy. You know why? Because you'll start feeling better and you'll start wanting to do it more, and then you'll start being healthier, and it snowballs on itself. Just get started. And related, it's a marathon. It's not a sprint. Okay? Take a multi-year approach. One thing I talk about with my patients is imagine that we take 3 years, and just every 3 months, once a quarter, we add on a new habit. And that means in 3 years' time, you will have 12 new habits. If you upgrade 12 habits, you'll be getting dividends from that for years and years from a health, energy, happiness perspective. Okay. Thirdly, you don't have to break the bank. The majority of the diagnostics, the majority of the value in what we are doing is diagnostics, and it's about $500 a year, and you can probably go even cheaper. And updating your habits, diet, exercise, sleep, stress changes, a lot of that is free. Again, you can go fancy if you want to, but you do not have to. And finally, find a doctor that meets you where you are and addresses your goals. Some people are motivated by someone yelling at them, telling them, hey, you got to be better. Some people are motivated by someone being kind to them. It's about knowing yourself, finding that right person for you, finding that right fit, and helping you get to results. So here's how you can get in touch with me. Website, vitaveda.health. There's my email, psharma@vitaveda.health. Twitter, YouTube, @vitaveda. Substack, vitaveda.substack.com. All right, let's learn some skills. So I wanted to leave with 2 silent killers. The first one here is blood pressure. It's a major driver of cardiovascular disease, kidney disease, and dementia. Here are the categories of blood pressure in adults. We're going to talk about how to properly take your blood pressure. This is something that anybody can do at home. An automated blood pressure cuff is about $40. I'll link to one that I share with my patients. It's on Amazon. But here are the categories. You want your top number, the systolic number, to be less than 120 and the diastolic number to be less than 80. Now, you don't want them to be too low. If they're too low, you'll pass out, right? What is too low? Well, there's not a number for too low. It just depends on the symptoms you're having. If you're getting really lightheaded, you're probably too low. You should sit down, drink some water, potentially call your doctor, depending on what symptoms you're having. Okay. Elevated is that top number being between 130 and 120 and 130. Now that at the moment we don't do anything about. Hypertension is defined when that's above 130 or if that lower number is below 80. These are new guidelines here. One caveat here: if your upper number systolic is greater than 180 or your lower number diastolic is greater than 120, stop whatever you're doing, call your doctor. Could be an emergency situation. You should get evaluated. Okay. Why are we talking about blood pressure? It's very modifiable without drugs, in addition to being very important. As I mentioned, cardiovascular disease, kidney disease, dementia, major driver of all of those. But either through your diet or through weight loss or exercise, reducing alcohol, and actually reducing stress, you can lower both of these numbers. So what I want you to really take away is that you should not be caught surprised with a high reading. Now, you want to take multiple readings so you get an accurate representation. And with blood pressure, if you are a little bit uncomfortable, or if your arm is too high or too low, or if your legs aren't kind of seated properly, or if you're in some pain, like you have to go to the bathroom, again, discomfort, then your reading's not going to come out proper. And that's why I think it's important to have one at home so you can test it at home. I tell my patients take 4 or 5 readings over a couple of weeks so we get a really good representative sample of what your number is. But all you really have to do is sit, relax, and sit up straight. Get your arm right about your heart height off the ground. Hit the button, see what your reading is. Don't stress it. Come back the next day or a couple of days later, do the same thing. If you don't sleep well one night, don't measure it, skip that day. It's totally fine. Then you'll get a sense of what your number's at. $40 for a good blood pressure cuff. The one that I have is $40, automatic. You don't have to worry about the stethoscope and all that. So this is just something that shouldn't catch you off guard because anybody can do it. And it's really, really important to have this. Okay. The second skill that I want you to take away. So I admit that one you do have to get a blood pressure cuff for. I know I said I'd give you stuff that you could take away immediately, but this one is one that you can do at any point in time. So I believe that stress reduction is a major, major underappreciated driver of chronic disease. Why is it a driver of chronic disease? Because when you are stressed, your body will release more cortisol, which is a glucocorticoid, which ramps up your body's blood glucose and kind of activates your anabolic system. You'll get more insulin flowing through you. And too much insulin has all sorts of negative downstream effects that we'll talk about in the future. But as that ramps up due to stress, it's just insidious. It happens a lot in our modern society and in our modern lives. And we don't have a great way of measuring it, which is why I think it's so underappreciated. And it shows up in lots of different ways. Poor sleep shows up in, as I mentioned, poor glucose control, but it's really hard to pinpoint that. And because we can't measure it, it's hard to tell what interventions are working. However, one thing that I found really helps a lot are breathing exercises. If you control your breathing, it manages your stress. It manages that fight or flight response. And there's multiple breathing exercises, and I'll link to in the show notes a document where I talk about what the different ones are. But the goal for pretty much all of them is to try to really inhale and exhale slow. And I found that when you exhale slow, that helps a lot. So I'm going to pause it here. Not pause it. I'm going to take you through it here for a few seconds. And we'll just kind of do one round of this. We'll do 3 really slow breaths, focusing on that exhale. If you follow me with this, I think you'll start to actually feel the effects. And as you train this, you'll be able to do it more and more, really almost on command, which is quite powerful. So let's do it. 3 slow breaths. Nice slow exhale. That'll really set the tone. And don't exhale so much so you're out of breath and you're gasping on the inhale. Just nice and slow. A nice slow inhale. Nice slow exhale. I can already feel it. One more. There you go. Nice slow exhale. And if you feel a change in your body, that means you're probably a little bit stressed. Obviously, I'm here recording my first video. That's going to give a little bit of stress. So that's not a crazy surprise. But there you go. That is it. That was the first episode here. I hope you learned something about longevity medicine. I hope you could kind of understand the framework. I hope it demystifies it a little bit, and you can see how this could be really helpful. It's just a new paradigm, a new way to address chronic disease prevention and functional mental and physical strength for as we age. And really, it's a way to supplement the current healthcare system, which is fantastic for what it does, which is acute care, but just it hasn't been modified yet to really fit for chronic care. I'm really passionate about this, so I appreciate everybody listening to this. Episode 1, so if you're listening to this, you're early. I really appreciate you, and really would appreciate your support. As I mentioned, give us a follow on Twitter, on YouTube, share this with any friends. And if anyone's interested in being my patient, please reach out. Happy to give you a free consultation to see if it's a good fit. And if not, point you towards whatever might be helpful. So then more content coming out soon to help you learn about this. And until then, please stay safe. Please stay happy.